Hi, doctor.
Hi, Griha. Good
How are
evening.
you? Good evening. How are you doing? I'm sure you must be exhausted with your hospital calls.
Yeah, but I mean,
Yeah, that's
I don't know.
that's
I,
the
I
nature
really
of the
don't know how
job.
to answer when someone asks me,
Yeah, I
how
know
are you
that.
doing?
I
Yeah,
understand. I understand. But yeah, that's the nature of the job. But right now, things have really gone out of hand, and people are really, really suffering.
yeah.
The kind of
So,
situation that we are in, it's crazy. It's crazy.
yeah. The only thing is that, so I am a fertility expert and a gynecologist. So I
Yeah.
deal with pregnant females.
Hmm.
Of
Hmm.
course, we kind of budge in and join our colleagues to help them out. But
Hmm.
honestly speaking, I mean, my tiredness and my exhaustion is, I think, not even nowhere compared to the ones who are really, the pulmonologists and the respiratory
Yeah.
doctors who
Yeah.
are
Yeah.
actually day in and day out doing their duties. So yeah, I mean, if just handling that small section of pregnant women can make me so tired, I can. I mean, I know
Hmm.
what they're going through,
Yeah.
and that's where sometimes as doctors, a lot of us and a lot of our friends, we kept on feeling that what more do you do? Like how do
Hmm.
you go back home at 8:30, but you sleep at 2 o'clock. That was the
Exactly.
whole thought. So what do you
Hmm.
do in that 8 to 2 these days? I think
Hmm.
nothing interests us these days.
Hmm. Hmm.
And yeah, and a lot of people were at a point where they were going off social media because they didn't want to listen to what was going on,
Hmm.
and rightly so. It was a mechanism that is valid, but
Hmm.
I think I was one of those person who kind of thought that I think we should not stop talking about it. I think it's the only thing we should talk about. And I'm not
Hmm.
talking about numbers here. You don't need to know
Hmm.
how many people are dying and how many
Hmm.
people are surviving and how many people are getting positive, but you need to know everything about a virus. They say,
Hmm.
when you want to defeat an enemy, you need to understand everything that goes on in that side. And that's
Hmm.
what we took into hand, and we thought about educating people. And that's what I started doing. And strangely,
Hmm.
it has given me some form of satisfaction, which I never
Right.
thought social media would give me.
Yeah.
And then the DMs, and then of course then it gets exhausting because you have hundreds of DMs that
Hmm.
help, but we
Hmm.
aren't able to help everyone. But yeah.
But so, Dr. Yuvraj, since you mentioned about, so many people contacting you through DMs, through SMSs, calls, what is this one common query जो COVID से related है? Because we talk about the novel coronavirus. As a doctor, would you say that we have somewhat had it under control when it comes to treating it? Do you think that the medication and everything is under control, or we are still figuring it out with the novelty factor? Do you think we have it under
It's
control?
an interesting question. So we don't have it under control, very frankly, but I think we still don't know how to treat COVID, honestly speaking. The only thing that we know is how to catch it faster,
Right.
hopefully.
Right.
And that's a tool that is proven to be very useful these days. The problem here again, and coming to your question, the most common question that I get asked these days is vaccination.
Oh yeah.
There is just, I mean, I'm at loss of words that why is there so much apprehension? I mean, I understand, but there's so much of self-doubt in terms of the vaccine that the country is producing that people are just not ready to take the vaccine. And that's where we decided, we need to keep on talking about vaccine, every small thing. I think I answer at least more than 100 queries of vaccine. I have hypertension, can I take it? I have XYZ, can I take it? I'm lactating, can I take it? I'm pregnant, can I take it? Fair enough. But I think that's the question that we need to address so that more people feel confident to get vaccinated. And I only think that's the way out right now.
So let's take that one question, Dr. UV. I think I am Gil 010812. Lactating
Yeah.
women can't take the vaccine. Is it true? That's what he wants to know. So just let's address that because we are also constantly getting
Yeah.
these questions. So let's address them
So
one by one.
that's actually true. Unfortunately, our government and the Ministry of Health right now has not put lactating mothers and pregnant women in the category of eligibility for the vaccine. But being a gynecologist, if you are a frontline worker, if you are in that high risk zone, I would go out of context here. Apart from guideline, with our experience as a group of gynecologists, that we have started advising lactating mothers to take the vaccine.
Okay.
Like if you're lactating, if you're brave enough and you're not very, very cynical about what's going on, please take it and take that chance, you know. But if you're pregnant, we are still avoiding, because unfortunately, if something goes wrong, there is a lot of liability here in terms of the hospital and the government. We don't want the vaccine to just stop because it was unjudiciously used, you know. So lactating, yes, on your choice. Given if you want to follow the guideline, no. Lactating mother and pregnant women are not yet advised to take the vaccine. Hopefully, we are in talks with a lot of these. So FOXy's Federation of Obstetrics and Gynecology, they've put out a statement that they think it's safe, and they're hoping that the government allows them.
Okay, so what I'm going to do is, since I have just recovered from COVID, I have had my own set of experiences and they come from a very personal space, obviously. I want to understand a lot of things. You mentioned pulmonary, breathing issues that people are facing. My own husband had lung damage when obviously he was suffering from COVID. He was advised hospitalization, but then things were under control. We had a concentrator with us and he took oxygen that was required, thankfully. Recovering slowly, but he still faces the breathing issues that are there, although he's tested negative. You know, how long does the lung actually take to recover? I mean, come
what
back
was the CT score?
It was 17 on 25.
So see, 17 means he was in the severity score. He was in the severe section. So that means you multiply it by 4. So it's almost like 60 to 70% of the lung was infected. So, you know, it's very similar to how you get a cut in your hand. You know, once you get a cut on your skin, your soft skin becomes the fibrous, thick skin and you have a scar. So very similarly, the lung tissue, when it gets infected, it gets damaged, and then the healing makes it a little more consolidated. So the only way you can recover faster from COVID is spirometry, which is the technical term of breathing exercises. You know, most of the hospitals now give that. You have 3 columns with 3 balls, yellow, red, and blue, and you keep on blowing it forcefully until the ball starts reaching up. Doing these deep breathing exercises and doing your chest physiotherapy is the only way out. And doing it, and that's a very important question, because, you know, you're recovered, but what about the long-term consequences, right? Unfortunately, we don't know the long-term consequences because it's been only a year, and at this stage, it's been only 6 months, so to speak. But if you're doing this, you will recover faster. How well you're doing your exercises, how well you're taking care of yourself post-COVID is going to become very, very important. But coming to lungs, yes, spirometry, deep breathing exercises, and forceful respiration will help you.
Okay, so like cricket, you know, and unfortunately I'm making this, simile here, that everybody now has an opinion about COVID also, you know, like the game. So a lot of people have different views, like the myths around the vaccine. A lot of people say that if you have recovered, you should not instantly go ahead and do these breathing exercises and all. How much of that is true? I mean, once you've recovered...
That's actually correct. So my uncle itself, you know, he was he had a CT score of 21. And luckily he recovered. And while he was recovering, I was suggesting the doctor, you know, why don't we start his chest physiotherapy, because I was really concerned how his lungs are going to be post he recovers, and he actually said no. But you know, there is a catch there. When you say no, doesn't really mean no, because you know what happens is you have to see the patient, and that's what happens when a lot of people ask for prescriptions, and you know, the doctor is not giving me steroids, the doctor is not giving me plasma, the doctor is not giving me remdesivir. No. I mean, the best doctor in the world on WhatsApp and Instagram cannot treat you. You have to rely on your local doctor. So the reason my uncle was not being given chest physiotherapy is because the moment he used to exert, his SpO2 used to fall.
Okay.
You know, so that was the time when he was on oxygen. And so that was the time they said, you know, in fact, for him, you know, we talk about proning, getting into prone position to improve your oxygen. For him, the moment they put him on prone position, he got so breathless that he was off oxygen. He had to then he was put back on oxygen for 2 more days. So when you're saying, see, chest physiotherapy is not going to cause you any harm. That's the first thing you need to remember. So when you're talking about myths, and that's what I keep on telling, you know, when it comes to COVID and when it comes to medicine, and when you don't know what is exactly working, what we work on is the risk-benefit ratio. You have to see where the risk lies and where's the benefit. So if your benefit outweighs the risk, you need to give it a try, because you don't know what's working. And in that case, when chest physiotherapy, if you feel that, okay, putting that much exertion initially in your body is not something that you would recommend, you start slowly. When I say chest physiotherapy, it did not need to start with Bhastrika pranayams being done and forceful. It could start from simple sitting, deep breathing exercises and then notch it up.
Okay. How safe is it? I mean, if in obviously utmost circumstances when you have to venture out, how safe after you've recovered is it to venture out these days? We are looking at the second wave.
Not at all.
Not at all.
Unfortunately, it's not at all. If you want to venture out, mask yourself, sanitize yourself, maintain social distance, avoid gatherings. I mean, you have to work. Unfortunately, we're not in a lockdown, so every one of us have to work. You have to do your essentials that you need to do in your day-to-day life. But you need to remember that every person you meet is COVID positive. Just behave like that. Right. And that's the only way out. That's the only way out. Unfortunately, so the reinfection data are less. I mean, by saying this, I don't want to tread on lines where I'm trying to say that the vaccines are not working. So the reinfection data that have come out of, like 80, 90 million people vaccinated was only 0.04 and 0.03%, which was very less. But now that the data is rising and the mutant strains are we even don't know how many mutant strains are there in the world right now. So the problem here is that you're not safe, but if you're vaccinated, if you move out and take care of these things, probably one, you might not get a reinfection. And second, of course, if you're vaccinated, then your severity and you are a little better than what you're not.
How is it, doctor? I mean, have we managed to figure this out that, the virus has affected two people completely differently? Like I got out of COVID in like a much nicer way. My symptoms were mild as compared to my husband's. We were quarantined together. So do we have an answer to that why is the virus affecting people so blatantly differently? And you really are not able to figure it out.
No, but that's how it is. That's how diseases are. That's how infection is. I mean, you might have an appendicitis and I might have an appendicitis, but I might have struggled for months and you might have recovered in 3 days. It's a very simple example, but that's how diseases work. Your body is going to react differently. And that luckily also answers a biggest question, that why do you need to take the vaccine after you have the disease? Because every body is going to react differently. And that also answers the question where people are fretting over, I want Covaxin because that's more and effective, and I want Covishield because that's less effective. One is 85% and one is just 76%, whatever, XYZ. But remember,
do you think this debate should be out there in the market? Which vaccine to take?
It's not, because, I keep on saying that, the situation is beggars can't be choosers, you're lucky if you're getting a vaccine today. In fact, I get so many DMs daily that, where do you keep? So people keep on telling me, you keep on talking about vaccine, but where do I go and take a vaccine? I said, I'm keeping on talking about vaccine because the day you have it, you don't have second thoughts on taking it, So coming to that question of why the body reacts differently, the same as with the diseases with the vaccine. So a vaccine, for example, Sputnik claims to have 95% efficacy. It might be 95% for my body, but it might be 65% for your body, because that's how your body is going to react. At the same time, I might take a Covishield. Maybe say, for example, an average Covishield efficacy is 75%. It might be 95% for me, but it might just be 50% for you. So your body is going to react differently. And that's why you give a second dose. Right. Why else would you give a booster dose? Because you want to make sure. And in fact, we are seeing, so yesterday I got my antibody titers tested, right? So so I have a group of, we are a group of friends, and 3 of us just got it tested for some specific reason. So all of us are vaccinated, My titer is 350. My friend's titer, the other friend's titer is 70. And one more, a pathologist, a lab doctor, her titer was just 12. All are vaccinated. So body is going to react differently. And that's the reason we need to keep on. And that's why, you can't throw away your mask after you're vaccinated. You can't think that, you have all the power in the world after you're vaccinated. And after you've had the disease, you still need the vaccination.
Like I have this question by Gargi Sharma. She wants to know, I want to ask about the problems faced by the person who's received the second dose of Covaxin. Like he's having a fever, which was 99 for the first 2 days and 100 to 101, and then fatigue and pain. So these after effects of vaccination, that two jabs already taken.
Yeah. So that's correct. And again, the same thing. why are we expecting COVID vaccines to not work as other vaccines? I mean, if most of us know, this is a very common thing when you take a child for vaccination, every one of us know when a child gets vaccinated, you're expecting some fever that day. Every mother expects a fever, when you take a BCG vaccine or you take any other form of vaccine. So it's the same with COVID. Once you take a vaccine, your body is going to form an antibody. Now that antibody is going to fight the virus that has been put into your body. And that's going to simulate a disease itself. But here the virus is not going to replicate. It is a dead virus. So the antibodies are still going to attack you. And that attack, that reaction, so I use the term as reactionary effects rather than adverse effects, because that somewhere sits in the brain properly, because that's the reaction that the vaccine is supposed to have. So if you have a fever, if you have a headache, if you have you might have redness, soreness wherever you have been jabbed, you might have some diarrhea, you might have some swelling, fatigue. This is all normal. If it lasts for some 2 to 3 days, take your simple medications that always vaccination centers are providing you, such as calpols and paracetamols and Danpi, and you're going to be fine.
In fact, Ayush Gautam wants to know exactly this. He wants to know, should we take paracetamol if we have the fever after getting the vaccine?
Yes,
Somebody's advised him not to. I mean, there's another
person. So don't take it before.
Okay.
The thing is, don't just think that you're going to have a fever, take your paracetamol and then go, because that's what a lot of people are doing. But in case you've taken the vaccine and you're being uncomfortable, of course you can take a paracetamol. It's not going to affect the efficacy of the vaccine. The only thing is, don't misuse it, because if the vaccine is going to have severe side effects, which is like 1%, even that I'm saying more, we don't want it to be, masked by these drugs. So then you need to know when do you approach a doctor also. So mild symptoms you're having, taking a paracetamol, it's all right. You've been taking at your home,
Okay. Now I want to know, after you've recovered, after you've tested negative, how many weeks after can you take the vaccine once you have recovered from COVID?
Yeah. So right now, exactly what our health ministry says is you need to avoid vaccine 14 days from you becoming symptom-free. That's the statement. And so that means that if you've turned negative, but you're still having symptoms, wait for your symptoms to go and wait for 2 weeks before you think of a vaccination. And that's what I stand by right now. And it's very clear. In fact, if you have any doubts, there's Ministry of Family Health website. They've given very clear guidelines. Just read that and that's your answer. You don't need to ask 10 people. It's very simple. It's made for everyone. And if you don't mind, in fact, today, ICMR has come out with the guideline that you don't, and that's very important, and I want to take it out, and I was just thinking of putting out it on my feed itself, that it's now please not necessary to get yourself tested after you've turned positive to just know that you're negative. It's absolutely unnecessary and it's not recommended. You've done your 15 days, you've become symptom-free, you don't need a negative report to go around.
Okay, but I've had people who have still not turned negative after 27 days, 3 weeks. Why is that? Precisely
the reason to not get tested, because once you're positive, the antigens might still, so there are a lot of false positive reports. So say, for example, even if you have typhoid, I'm giving a different example, because if you have typhoid and if you've had, say, for example, syphilis, your typhoid might still come positive, though you don't have it, because of the cross reactions of different things. So in this case, you might have a positive report, but it's not an active disease, right? Because you have these antibodies. So in that case, because you might have those, see, the virus might still remain in your body. It might be a dead virus, but it might, uske अंश अभी भी body में रह सकते हैं. The DNA might still be there. So sometimes, and also apart from all that, there is also always a lab error. That's something you have to keep in mind, and that's the reason the government has asked you to not keep on doing these reports, because we're doing like 15-16 lakh tests a day, and that's just reported. The ones that are unreported, we don't know. And there are like 2,000, 3,000 accredited laboratories around the world. You imagine the workload.
One query that is coming up again and again, this is by Aishwarya. She wants to know if you are overweight, like if somebody is 160 kgs, I think this is the weight she's mentioned, is it safe to take the vaccine? These are the kind of questions that people are also asking.
So ideally, I would just say yes. Everyone can take a vaccine. There's very few contraindications to take a vaccine. So I'd answer it in the opposite way, that when you not take a vaccine. So one is if you're positive, if your symptoms, if you have been treated with plasma treatments and monoclonal antibodies, and if you've specifically been proven to have allergy towards the vaccine components.
Okay.
Because that's very important. When you read that allergies is a contraindication, doesn't mean you have a peanut allergy and you don't take the vaccine. It only means that your body is prone to allergies. So when you go to a vaccination center, just tell them that my body is prone to certain allergies. These are my allergens. So they'll do a allergen test. They'll do a patch test, check whether you are reacting to the antibody. If not, they'll give you the test. For the patient that for the lady who, or whoever, the gentleman who was asking about obesity and vaccine, if you're just asking whether I should take or not, you should take it. The only thing is, if you're worried about the clots, because obesity is related to increase propensity to develop clots normal life, and then you're worried with the vaccine, then in that case, if you have some or these other metabolic syndrome, talk to your doctor. You can be put on blood thinners before you take the vaccine, and that's sorted. But please take the vaccine.
Okay, some basic queries coming in here. Now that it's open to 18 plus, a lot of people have not even registered. So if you can briefly let people know about the process. I mean, you go to the Ministry of Health website, go ahead, register. How can they go about, looking for a proper slot for vaccination, whichever city they are in? Just briefly, you can just go through that, please.
So, honestly, I have not been to that website. I mean, I've not had the time to check the website. So I don't know the exact steps of how do you do it. But I think that's everywhere. You just need to search registering for COVID website, COVID vaccination. And I think especially when we talk about 18 plus group, I think we all know how to use a website and how to use a computer. So I don't think it's going to be a rocket science developing that. But I very honestly, because I was vaccinated in Jan in the first batch of doctors that were vaccinated. So I never went to the website to check how is it done. But in fact, there are a lot of social media influencers who are putting out the way you can do it. But please get registered. Right. I know the vaccine is not right now, but get registered so the turn comes as soon as possible.
At the beginning of the chat, Dr. UV, we were talking about so much of news that is coming in, trickling in, affecting a lot of people mentally also. We have to take care of our mental well-being. A lot of friends you get to know, things are happening in their houses. There was this particular friend whose wife was admitted to the hospital. She was obviously critical, needed an ICU bed, which is unavailable in Delhi NCR, where I'm talking from at the moment. Really bad situation. Then there was this whole talk about desperately wanting plasma. Finally, she got the plasma. Now there is so much of debate about, is it even effective? Do you want to address that?
In fact, yesterday, we were just chatting about this, and I was explaining to people. And so I would like to address this actually in a non-scientific way here. The reason here is that, so if you take the guidelines, we really don't know whether plasma works or not, very honestly speaking, because all the studies, scientific data, I'm not talking about newspapers, I'm talking about scientific data. If you see, even ICMR has put out a statement saying that, there was a placid trial. So trials are these best forms of studies that determine whether a treatment is working or not, did not show any improvement against people who were not given plasma. All right. But, as I said earlier, we don't know what is the treatment. If we knew the treatment for COVID, I think these many people would have not been lost. So now the question comes, as a doctor, this is what happens when a situation comes where you don't know what to do. And this is coming very often with COVID. When you don't know what to do, that's what we call as cocktail therapy. And what cocktail therapy means is you want to try everything possible. All right. Until and unless it's like, it doesn't do you any harm. So in fact, I gave one of my pregnant patients got a plasma last week, where we were still debating what to do and what not to do. We were not getting remdesivir for her. We were not getting oxygen beds for her. We finally arranged for an oxygen bed, and we were seeing that she was deteriorating, right? So we just went ahead and said, like, what's the harm in giving? Just let's give us. Zyada se zyada kya hoga? We don't know what's going to happen. Koi harm to nahi hai. And she recovered. Now, I'm not going to say she recovered with plasma. She's doing very well. Maybe the oxygen worked, maybe the rest worked, maybe the other antibiotics worked, but it didn't cause any harm. So when people are talking about plasma, when people are putting requests, and that's what I really want to tell everyone, when people are putting requests about helping them with plasma, and people are helping them put out that, amplifying that request, please don't shun them saying what rubbish it is and, plasma doesn't work. Because, if you and me were unfortunately in a situation where a loved one was being, we were losing a loved one, we would want to move hell and earth to do everything possible. So scientifically, yes, we are not sure whether it works or not, but we know for sure it's not going to do you any harm. So if your doctor thinks, let's give it a try, let's give it a try. But if your doctor is not giving you plasma, don't fight over plasma.
Correct. A lot of people are also paranoid. I'm sorry, I'm interrupting you. बहुत ज़्यादा paranoia है. People are running and doing their own treatment. Today, AIMS, obviously, a panel of doctors came out with the adverse effects of CT scan, or steroids, taking steroids. Unless and until your doctor has advised you to do that, you should not go ahead. But a lot of people are already, like RTPCR, they're just going ahead and getting a CT scan done, whether it's required or not. What do you have to say to that?
Yeah, please don't do that. See, you take an antibiotic, I'm fine with it. You take vitamin C, you take zinc, I'm fine with it. But when it comes to steroids, see, a lot of people, in fact, we've had cases who were diabetic and they didn't know. But see, everyone doesn't know that steroid ka ek effect hota hai increased glucose levels in your body. So if you're diabetic and you start taking steroids, your glucose is just going to go haywire, and you might not, your COVID might be recovering, but your sugar might put you in IC. So steroids, higher level of antibiotics, remdesivir, these are injections that you cannot take it yourself. These are drugs that you cannot take it yourself. You need to consult a doctor. And I just wanted to complete the last thing. And only when you talk about plasma and remdesivir, we just know somewhere that if you're catching these infections and you're treating them with plasma and remdesivir in your, say, around 3 to 7th day of your infection, it might probably work. But in a severe form, post your 10th and 12th day, it's really not going to help. So it helps in the initial phase. So if you want to try that, that's all right. But don't self-medicate.
I've had a friend whose entire house tested positive. There is this person's wife who's pregnant. She's thankfully not positive. What is she supposed to do when it comes to precautions? When you have a pregnant lady in a house full of people who have turned positive, what is the best possible outcome that you can actually to stay safe?
Pregnant women should be extra careful. Because the problem is, if a pregnant woman catches COVID infection and she catches a severe form, she is going to deteriorate way faster, and it's going to be very difficult to get her out of the infection. So when you have a pregnant woman in your house and you're all turning positive, I think it's better to isolate her first. You can't have her running around everywhere. Second, you need to not come in any form of contact with her. And I think, see, the precautions are going to remain the same. All right. Yeah. But you have, it's everything is the same. But the only thing is, with what I want to stress over here is, with pregnancy, you need to be really, really careful, because pregnancy has, we know it for sure now. If pregnancy gets affected with COVID, and if you get into that red zone of severity, the chances that you will require oxygen, the chances that you will require a ventilator, and the chances, unfortunately, that we might lose you becomes very high. So if you have a pregnant female in the house, take extra care, keep everything near your door, sanitize twice before you come in, make sure that you wear your mask when you go out, because you should not be the one who's giving her infections right now.
Right. And is it advised to take some precautionary medication or some multivitamins for a person who is in the same house?
Yeah, the pregnant woman is anyways on multivitamins and iron and calcium and everything. What you can do is, everyone's now taking vitamin C, zinc. So go ahead and take them. That's not going to cause any problem to you and your baby. But unfortunately, vitamin and zinc or any of these multivitamins or antioxidants is not going to provide you any form of protection against COVID. The only form is maintaining COVID etiquettes, and that's very important.
So before I let you go, doctor, I know there's a lot. I mean, I'm holding you after you have come back from the hospital. I don't want to do
it's
that.
all right.
So many
In fact, we can take a few questions because then everyone starts complaining that I never answer the questions.
So this is by Vaishnavi. Is the interval between 2 doses, if it is long, is it okay? Will it be effective? Will the vaccine be effective? Because due to shortage, people are having to wait for the second dose. This is by Vaishnavi.
So for Covaxin, it's been extended till around 4 to 6 weeks, and for Covishield, it's almost, they say till 12 weeks it's all right. So you still have a window, saying that if you're still not getting the vaccine, take it as soon as possible.
Okay. This is another person caught in a trance. I'm pre-diabetic, recovering from COVID, have sleep disorders and anxiety. How to cope with it?
So if it's really bothering you, take help. There are amazing free consultations and therapy that a lot of people are providing now online also. So you take help, or else I don't think there's a medicine answer. I'm not going to tell you to take an anti-anxiety drug or take a sedative or just try all those meditations, your sleep music and everything doesn't work. Take help. It's all right. Just take help.
Okay, this is by Puli Pak. I think this is, Puli Pak Sharma. This is a very practical question, and I think this should be answered. My dad has taken Covaxin in a government hospital. Now they've stopped giving vaccination. Can he take Covishield if it's available nearby, if the first dose is Covaxin? Can he do that?
Ideally not. So please try to take the same vaccine. If it's a little delayed, it's all right. Okay. But if you're really not getting the vaccine, then get the other vaccine complete dose.
Okay, this is by Rachan B. Reddy. My mother is under depression tablets and she's 50 plus. So she's under medication, which makes her sleep a lot. Is it okay to take the vaccine?
Yes.
She's on antidepressants. Okay. All right. A lot of vaccine questions. All right.
Please,
so
let's take the vaccine questions.
This is by Melvita. She says her dad has cancer and he's on his 3rd stage.
Please
he's living with
vaccine.
Cancer. Okay, he should take the vaccine.
Cancer, chemotherapy, HIV, take the vaccine. In fact, you should make sure that your dad takes a vaccine. See, because if your dad is suffering, unfortunately, from some form of cancer, maybe he's getting treatment, maybe he's going to undergo a surgery for that, or chemotherapy or radiation, your dad's immunity is going to go really, really low. And if he catches a COVID infection, it's going to be really dangerous. So take the vaccine. Whatever little help you can give, it will help.
Okay, VV Krish wants to know that he's recovered from COVID, but he's suddenly got into a severe dry cough. What really is happening here? If you can address this also.
So that's a very common thing, because of course your throat and your lung have been affected, having dry cough for a little time. Take good steam inhalation. If it's really bothering you, you can take syrups, that is anti-cough syrups such as Tusq and Rosudex and a lot of Ilex. You can, there are those pills that you can take that you can put in your mouth and chew them around. Alex lozenges you can take. So these I can, because these are over-the-counter drug, I've given you some names. But in case so very important, if you have a cough that is with pus, then you need to have a different prescription. Talk to your doctor.
Okay, and correlating with that question is by Preeti, can a bronchitis patient go for vaccination?
So now, if it's an allergic bronchitis, then take your allergic test first and then go for it. Otherwise, yes.
Okay. This is by Chiu 1643. She says, my mom was COVID positive. She got discharged from the hospital, but right now she's got muffled voice and now she's having a loss of hearing. Is this a post-COVID symptom is what she wants to know?
It could be. So if she's having a loss of hearing, so virus has a lot of whenever you get infected, loss of hearing is not only with COVID, it can happen with any form of virus. Even if you have an herpes virus or even if you have some other form of virus infection, a lot of nerves might get damaged and your hearing nerves might have got damaged, or it might be a temporary inflammation of your hearing nerves, which might go away. But if there is a loss of hearing, you need to go to an ENT specialist, which means the ear, nose, throats. So ENT specialists, please convey, because they might put you, because see, again, this is again an effect of antibodies. So the antibodies that were fighting the virus have been attacking your nerves. So they might put you on steroids. Don't start steroids, please. They might put you on certain medications that might decrease your inflammation and your nerves might come back. But please get it checked.
And since we're talking about steroids, doctor, I also want to know, for example, obviously, like, my husband was advised steroids, and is that because obviously you take it for a brief time in the second phase of COVID, the next 6 days, the last 6 days he was taking it. Is it important to taper it down, or we can stop the medication after 14 days?
No. So they will taper it down, and it's always better to taper the steroids down. And one more thing around steroids is that I want to address is a lot of people start asking, oh, my mom or my dad or my relative is on such a severe condition and the steroids are not being started. Remember, steroids is a double-edged sword. Steroid means you're lowering your immunity. Now, think about it. If you're lowering your immunity, what we try to do in mild diseases is that your antibodies, when you lower your immunity, the lesser the antibodies will affect your normal body. So that's what we are desiring. But when the infection is at its full flare, and if I start giving you steroids and your antibodies go down, that means you're giving the virus and the other bacteria in the world to flourish now. So that might deteriorate your condition. So sometimes a doctor takes a call in not giving a steroid and giving a steroid. So that's the tricky part of it. So that's why steroid is not an answer to everything, especially in severe situations. So that's something that please remember.
Okay, Alex wants to know, my dad has CRP, which is 10. Is vaccine advisable?
Why have you done a CRP before vaccine?
Yeah. What do you have to say? In case if you're going for these tests just before vaccination.
Yeah, you don't need any test before vaccination. You just don't need any. In fact, my CRP for some reason was 72 at one point of time, 1 year back, So that doesn't mean I had COVID, So doing these tests is see, CRP again. Remember, CRP is not a COVID test. CRP is in our labs, in our pens and prescriptions for years before COVID had come. CRP means C-reactive protein, which is something that is secreted with chronic or infections, something that the body secretes in any form of infection. So even if you have a UTI, even if you have a long-term sinusitis, your CRP might be high. So don't cling on to a CRP, please.
Okay. So I'm getting a lot of messages that said this has been a very, very informative session, and thank you, Dr. Yuvraj, for this. This has been really, really informative, and this is what we wanted, because people still have a lot of questions about COVID, and I'm glad that we did it. मेरे पास खुद इतने सवाल थे after recovering that I wanted to know about. So thank you so much for answering those questions. I'm sure a lot of questions are still coming. I don't know, just take last couple of them and then we'll say bye-bye.
No worries.
This is by Neha. She wants to know, okay, a lot of people are complaining of diarrhea. So she said that I had 5 motions till the afternoon, gastric, and vomited twice. But since noon, all is okay, no other symptoms. I am 13 weeks pregnant. Is there anything to worry about?
See, so now COVID has become 2 types. There is a pulmonary COVID and there is a non-pulmonary COVID. And diarrhea has become one of a very known symptom of COVID. Saying that you're pregnant, having diarrhea, having stomach upset and gastric upset is something that's normal. So what I would say is, if it's just a day's phenomena, wait for a day. If you don't have fever, if you don't have throat infections or any other form of loss of taste or symptoms of COVID, wait for a day. Take your normal ORS and get hydrated, and you might take care of your diet, which is whatever you take for the diarrhea diet. And if it's all right, just forget about it. But in case if it persists, then get tested, because you're pregnant. Be a little more vigilant. Check your SpO2.
Right. Okay. And one last question. This is by Noori Nazni. She wants to know that her mother is SLE patient and is on steroids for the last 20 years. Is it safe to take the vaccine for her?
Talk to a rheumatologist or an immunologist. It's very important.
Right.
See, let's let that be the end message. Vaccine has to be taken by everyone. If you are doubting because you have some form of disease which is rare, talk to your doctor, because anyways you're being treated. Just pick up the phone and talk to them about vaccination. Otherwise, take the vaccine. And that's it.
Right. Dr. Yuvi, thank you so much for doing this. This was a great session, very, very informative. And, obviously everybody has to thank you because there are a lot of questions that are coming in and everybody has to be completely informed about this virus that has attacked us suddenly.
I'll tell you something apart from COVID. I'm so happy that, you asked me to do this because so a group of doctors have come together and we're trying to spread as much awareness on Instagram as much as possible.
Yeah.
And the problem is doctors don't have that reach. We've not been influencers. We've been working. I mean, our accounts are not accounts that have millions of reach. So we are looking for people who are in media and who have a greater reach, so that that's where the impact is going to lie. In fact, and people might think I'm stalking them. I've been messaging influencers and I've been messaging stars, like for example Nakul Mehta has been he's been in communication with me, and I keep on budging him that you need to talk about vaccine, you need to talk about this. And that's because and I keep on telling him that unfortunately I wish today I had your number of followers, not because I want to become an influencer, but because so that my voice could reach more people.
Right.
So I'm so happy that people like you, and it's great to see people who have not posted anything except fashion stuff are now talking about a vaccine. When Vogue India came, I was like shocked. The child in me was jumping, but I was so happy because that's where the reach is, and that's whom people unfortunately right now still listen to. So I'm so happy you did that, and I'm glad to be here.
So, and a lot of people are asking, I will be posting this session on my IGTV. All the questions have been answered, and you can just refer to this video anytime so that whatever queries you might have regarding
and you can DM me. We've got together a group of around 20-25 doctors, and we try to answer every DM we are getting. So my account has been given to a lot of my students, a lot of my colleagues. We are sharing the password. So we try to answer everyone possible. So if you have any doubt, I don't mind. But please remember, don't ask us doubts that are not related to COVID right now. We would really want to help you, but there's just no time, So any COVID related queries, please message us, DM us, and 100% someone will get back to you.
And before this is a very wonderful message that I just saw. This is by N.R. Thakkar. He says that, sir, my wife is pregnant, also suffered from COVID, and after doctor's support, she fought against COVID. She is now negative 14 days and delivered a baby girl at a hospital. So that's a wonderful, wonderful news. A woman who was pregnant obviously won the fight against COVID. That's really beautiful, beautiful. So thank you so much, Dr. Yuvi, for doing this, and
thank you so
you're
much.
doing great work. Thank you so much.
Thank you. Stay safe.
Thank you.
And
You too.
see you soon. Bye.
See you. Bye. Bye.